When you speak with the doctor, he may recommend you to go to a sleep lab for sleep examination. This video will give you an idea what you can expect from a sleep lab experience. If everyone slept well each night, there would be a little reason for sleep lab and sleep studies. Unfortunately, sleep disorders that can dramatically impact on your health and well-being are quite common. Your doctors recommended that you have sleep study so that any problem can be identified and treated in most effective manner. Sleep studies are comfortable experience, can be quite interesting if you know about what's going on. This video will give you an idea of what you can expect in your sleep lab experience. Sleep studies are done by sleep technicians or sleep techs. Their job is to make you stay as comfortable as possible while gathering the information needed by your doctor. The sleep tech will be monitoring your sleep from a separate room and would do as little to interrupt your sleep as possible. Sleep tech wants you to be confident and comfortable, so please bring any questions or concerns to their attention. Sleep studies involve a recording of sleep on sonogram. To an untrained eye, it might look like lots of squiggly lines, but to a sleep disorder professional, they are moment by moment detail of your sleep and a basis for an accurate diagnosis. When you arrive in a sleep lab, your technician will measure your height and weight and give you a tour of a sleep lab. The technician will also measure your sensor placement using a tape measure. Most rooms are equipped with a TV to help patients feel more at home. An area for changing, brushing your teeth, washing your face, and other sleep preparation activities is provided for you. Soon, your sleep tech will be ready to connect you to a number of devices that will measure your sleep patterns. While getting hooked up, your job is to stay relaxed and responsive to the sleep tech. Your sleep tech is trained to ensure that the process goes smoothly and comfortably for you. You should let them know of any questions or concerns that you have during the process. First, your sleep tech will clean areas of skin that will have sensors applied to them. This process usually uses a scrub that is slightly abrasive, like face scrub. Next, your sleep tech will attach many round-shaped sensors. These sensors are generally pasted on and will be washed off later. The probes on your head measure brain waves, muscle tones, and eye movements. These are useful in determining what stage of sleep a patient is in. The strips around the chest and abdomen, along with sensor near your mouth and nose, measure your breathing. The sensor on your finger or earlobe measure heart rate and blood oxygenation. None of these sensors are painful or difficult to wear. Rooms are also equipped with infrared cameras so that the sleep tech can observe and record your sleep. You may be in dark, but you are being monitored. It is soon time to be ready for bed. Prepare for tonight as you would have for any night to sleep. Majority of patients referred for a sleep study by their physician are suspected of having an obstructive sleep apnea syndrome or OSA, which makes it very difficult to get restored to sleep and breathe at the same time. Sufferers of OSA tend to be drowsy in the day, just as anyone who did not get a good night's sleep. The most preferred treatment for moderate or severe OSA is continuous positive airway pressure or CPAP. CPAP applies a light air pressure to the nose or mouth. This pressure is enough to keep the airway open so the patient can breathe normally while sleeping. The technician may show you this equipment and adjust it to fit you before it is time to sleep. At night, those who suffer from OSA snore heavily, are restless, and often need to go to bathroom 2 or more times. If the presence of obstructive sleep apnea is found and documented during the night, the technician may re-enter your room and help you put on a CPAP mask, which is attached to a CPAP machine. Once you fall asleep again, your technician will wait for you to enter a deep sleep and gradually increase the pressure CPAP uses to keep the airway open. The CPAP can end the struggle to breathe during deep sleep, allowing the user to get sleep in the air they need. While you are sleeping with the CPAP machine, the sleep tech will determine and document the minimum pressure necessary to keep the airway open and the CPAP machine's effectiveness in controlling the apnea. Now, it is lights off. Time to relax and get some rest. Your technician is monitoring your data for quality and any sleep disorders. Their job is to keep you safe, fully documenting your sleep. All those probes are now collecting data that will provide detailed story of your night sleep. A definitive diagnosis can be made later by a sleep specialist using the data collected. When morning comes, the technician will wake you and remove all probes. The data then gathered will be organized and scored for being reviewed by a physician specializing in sleep medicine. Your sleep study is the result of a detailed bracket of your body's sleep along with any diagnosis and treatment recommendations. Please remember, although the technician has monitored your sleep all night, it is only after the data is analyzed by a physician that the diagnosis can be made. When the data has been analyzed from your sleep examination, the doctor will be able to make a diagnosis. He will inform you of may or may not be wrong and possible treatment options. This video is brought to you by Philips Respironics. If you are diagnosed with sleep apnea, your doctor will possibly recommend CPAP machine as treatment. CPAP is the most effective and widely accepted treatment for sleep apnea. For further information, visit www.sleepsolutions.com.